Okay, let's get started so we're not dragging your evening out too long. So my name's Claire Johnson. I'm the Widening Participation and Outreach Manager at Brighton and Sussex Medical School. So my role at the medical school is I'm responsible for organising open days. We go into schools, give talks, we organise our undergraduate interviews, the whole process. So I have a wide view of the whole admissions process for students applying to Brighton and Sussex Medical School. I've also got with me this evening one of our students, so I'll just get her to introduce herself.
Hi, my name's Hannah, and I'm currently a fourth year medical student at BSMS.
Brilliant. Thanks, Hannah. So Hannah is going to be giving some student points of view because I know that you'll find that far more interesting than potentially what I have to say. So she'll be chipping in through the talk. We also have a Q&A function, so you'll see that on your screen. So if you have any questions while the talk's going on, please put your questions into the Q&A. Hannah will answer some as we go along. Otherwise, we will answer the questions at the end of the talk as well. So hopefully you can all see my screen. So this is the outside of our medical building that you can see at the moment. So let's get started. So, right. Who are we? So we are quite unique in the fact that we are a medical school that is shared between two universities. So we are jointly between the University of Brighton and the University of Sussex. So this means that our students can go across both universities. They are members of both universities and can use the facilities on both sites. We also have close links with our local NHS partners. So they are the ones that will host our students while they're on their placements through the different years while they are with us. So where are we? So we are down on the south coast of the United Kingdom. So you can see that nice blue pin at the bottom of the map. And so you can kind of see within the bigger circle, this is an overview of Brighton from the air. So we've got Falmouth. So we're actually based up at Falmouth. So that's where our campuses are. So that is both where the University of Brighton and the University of Sussex campus is. And that's where the main teaching takes place in year 1 and year 2. Then you can see down at the bottom, there's this orange pin just above the name Kent Town. So that is where the Royal Sussex Hospital is based, and we have teaching facilities down there. And from year 3, this is where students are predominantly based. They won't be coming up to Falmouth as much for their teaching or lectures. It'll be more held down at the main hospital site. So this gives you a bit of an overview of the two campuses up at Falmouth. So you can see on the left-hand side, that is the University of Sussex, and you can see the pin where our teaching building is. So on the Sussex side, we have our main lecture facilities and we have our dissection room. So that's where that is based. Then you can see the road kind of splitting the picture in half, and you can see the big football stadium, which is Brighton and Hove Albion Football Stadium. And right next door to that is the University of Brighton campus. And then you can see the pin where we have our building on that campus. And this is where our students learn about clinical skills. So learning things, how to take a patient history, how to take bloods, how to do injections, all those kind of clinical, more hands-on skills are based over on our University of Brighton site. So let's have a look at kind of applying for medicine. Medicine is a competitive course to get into. It doesn't mean that it's impossible to get into. So on the screen now, you can see the amount of applications that were to medicine this year nationally. So we can see for 2026, so this is when students had to have their applications in by October 2025. There was just over 20,700 home applications for medicine and just over 5,000 international applications. This was quite a jump from the previous year. We actually saw a bit of a dip last year in applications. So we saw quite a rise in our applications this year. So what does this mean for Brighton and Sussex Medical School? So this is our application figures for this year's cycle. We are still actually in our cycle. We've got up until next Wednesday, the 13th of May, to make all our offers by. We've made the majority. We might just make a couple more, but we're kind of nearly there on what we're going to be offering. But you can see that this year for home students, so home is and Channel Islands, that's what CI stands for, is Channel Islands. We had 1,381 applications for us this year, and 237 international. Of those applications, we interviewed over half. So we interviewed 754 home students this year. And our interview process, I will kind of cover a little bit, is a bit later on, but we offer students the opportunity to be interviewed either in person or online. So far to date, we've made 586 offers to home and 38 offers to international. For this year's cycle, so for starting in September, we are looking to take 197 home and 11 international students. So you may be thinking that, Claire, these figures are looking a bit wonky. Why have you made so many offers when you only have 197 places? And that is a great question. The reason is obviously students have 4 universities that they can apply for, and potentially they may have 4 offers from medical schools. And so therefore we may not be a candidate first choice. So we might be put as their insurance, or we might be declined by them completely. So we have to make over offers to make sure that we hit our target number. We also we'll also unfortunately lose some students on results day, just because they do not meet the entry requirements to get into us. So we need to make sure we've got a bit of a buffer to ensure that we hit our target of 197. So this is how our numbers kind of work, and it's the same logic for the international numbers as well. So our numbers, just so you're aware, are capped by the government. So we can't exceed these numbers. These are numbers that are given to us. So it's quite unique. We're about the only course, I believe, that is capped by the government with regards to numbers. And that's the same at every medical school in the UK. So we are given a set number of places that we have for each year of study. So why to use BSMS? So it's a great sign that you've logged on today to listen to us and find out a bit more about Brighton and Sussex Medical School. But what are the kind of things that we think you might be thinking about and why you might choose us? So we have an integrated course structure. So this means that students have placements and learning clinical skills right from year 1. So in year 1, Tuesdays are allocated to clinical skills and placements. So they'll be going over to the University of Brighton site, learning those basic but essential skills, and also starting to go into GP surgeries, so starting to very observational, just learning how the surgeries work, seeing how the doctors interact with patients, understanding kind of the type of questions that the doctors are asking as well. So we also, the way that we teach anatomy at Brighton and Sussex Medical School is that we use full body cadavers in our dissection room. So once again, this is from the first year. I think it's about week 2. Students will be starting to go up into the dissection room, and they'll be put in a group and they'll be allocated a cadaver which they'll work on for that year. This experience can be quite overwhelming for students when they first go in there, but our anatomy team is excellent. They explain what they're going to experience before they go in, type of things they might feel while they're in that room, and help care for them especially through that first session. So Hannah, do you want to chat about how you found your first dissection session?
Yeah, of course. So obviously it's quite a daunting thing to go into, because obviously you're there with a body and it's nothing that you've really experienced before in your life, sort of thing. But I think it was a really valuable experience that we got to have, because people aren't really like the textbook that you learn. So doing the cadaver dissections, you get to see them, you get to see all the differences between people. And the anatomy team were amazing in terms of helping us out, pointing at different structures, seeing things better. And yeah, I think it was just an amazing experience to get to do together.
Brilliant. Thank you. So in year 2, for anatomy, it moves more to prosection. So this is where specimens are being expertly kind of dissected, because we're looking at the finer structures, so the nerve structures, and so it needs more delicate dissection, which our second year students just don't quite have the skills to do that yet. So that is done. So we've talked about the early clinical placements already, and obviously Brighton as a city. Brighton is a very vibrant city, and especially since Easter is literally just come to life. There's a lot going on in the city constantly. So we're in the middle of Brighton Fringe, where that means that there's lots of spoken word, cabaret, comedy, lots of things going on, and the real price range. So some is pay what you want, some is more expensive. As well as that, through the summer, we have various kind of festivals that go on. So there's always kind of something going on in the city. And obviously, being by the sea and having the beach is a real plus point for a lot of the students. And it's probably one of the reasons that they choose us is our coastal location. But we also have very quick links up into London. So we are an hour, direct train hour to London from Brighton, and it's about 35 minutes to Gatwick Airport as well. So we're very well located. Hannah, how do you find living in Brighton?
I love Brighton. Again, the being by the sea and a big like a city as Brighton is was one of the things that kind of drew me to BSMS originally. There's so much to do in the city, so many like restaurants, cafes, pubs, like so many places to go to and things to do with your friends. And then there's also like loads of nice walks like Stamner Park, you've got close by, Devil's Dyke. Like there's so much you can do. And then I'm so close to the beach right now, so we're constantly down there with my friends and everything. So it's a great city to live in, and it's very like student centered as well, which is what I really like about it.
Oh, thank you. So, a little bit about our curriculum. So, let me just get some of these. So, I kind of mentioned about our integrated systems based approach. So one thing I haven't spoken yet is about student select components. So these are kind of optional modules that students can choose through their first and second year to kind of complement their set curriculum. And these can be a real range in the types of modules that you can choose from. So some might be around imaging, so looking at ultrasounds and getting more experience on doing imaging. Some can be around well-being, so it might be yoga sessions and looking at mental health and those types of things. So there's a real kind of range of things. Hannah, what were some of the student select components that you did?
I think I did some on pediatrics, and then there was like some global health stuff, and then there was also an art one I did at one point, like mindfulness and stuff like that, which was really fun as well.
Yeah, one of our academics does a lot around art and comedy to try, not comedy, sorry, comics, um, to try and explain more technical terms to their patients and things. So that's quite one of the modules that we have as well. So time for dementia and time for autism. These are quite unique courses to BSMS. So basically, this is when a student is allocated a family that is affected by the dementia or autism, and they're kind of so they're assigned for them, and basically they'll go in, have meetings with this family, learn about how the condition is affecting not only the patient but also their family and relatives and how it affects them on a day-to-day basis. This really helps our students get a more holistic view of this illness. And as we get older, as our population gets older, we're getting more and more cases of dementia. So it is becoming more common within our societies and populations. So that has been established for a long time. And for the last few years, we've introduced time for autism, which is exactly the same premise. So students are allocated a family which has someone that has autism. And once again, they'll find out about how this person copes with having autism, some of the things that might affect them, how it affects the family or their day-to-day like living. Do they have to adjust? So once again, they can see a bigger picture rather than just knowing the kind of technical medical side of the condition. They're seeing a bigger view of it. So these are really, students really value these experiences and being able to ask those questions that you wouldn't necessarily be able to get from a lecture or a book. So year 4 is an independent research project. So basically, Hannah will talk about this later because she's just in the process of finishing her independent research project. But it's kind of like the equivalent of a dissertation on a normal degree. But we do this in year 4. We are classified as a small to mid-size medical school with, like you saw, we take about 200 students each year. So this does mean that our academics get to know our students quite well, and we do have a lot of small group teaching, which is great for our students to be able to facilitate that. So all the way through the degree, they have personal and professional development. This is about reflection, ethics, it's about professionalism, what's acceptable. And this is a kind of underlying theme through all years of their degree because it's such an important element. Oh, and all of our students get a personal tutor as well. So they'll get an academic personal tutor, which is allocated to them when they arrive. We also have like medic families. So this is where first years are kind of buddied up with second year students so that they can ask them more things about like more the social side of the medical school, or if they're struggling with like study techniques, they can go to their like medic parent and ask those types of questions. So they'll have kind of social events where they get to meet other first years and other second years. And it's a really good way for us to help integrate between our different year groups so that people can ask for help and support from people that have kind of been through that year recently, so kind of know what to expect and can probably answer those questions a lot better than our personal tutors because, you know, they've experienced what we're going through. So this is how our curriculum is kind of structured. So we have 3 phases of teaching. So phase 1 is year 1 and 2. And like I stated earlier, this is mainly held up at the Falmer campus. So that building you can see there, that is the teaching building on the University of Sussex campus where our dissection rooms are and our lecture theatre. So year 3 and 4 is phase 2, and this is where you'll be out on your placements more with our regional partners, and your teaching will take place in the Audrey Everton building. So this is opposite the Royal Sussex County Hospital, and once again we have lecture facilities and teaching facilities in there as well. Year 5, we don't actually see that much of our students because they are on placement a lot, so around the county, and I'll cover this in a bit more detail in a second. So here you can see kind of an example of the timetables that students will have in year 1 and year 2. So the clinical and community practice, that is what I spoke about earlier. So that is their Tuesdays where they're learning about clinical skills or they're out on their placements. Then you can see that they've got 3 other kind of areas that they'll be covering in the first year, and that got that personal and professional development running all the way through it. Hannah, when you came into BSMS, how did you find that transition from sixth form to year 1?
I think BSMS does it quite well in the sense of your first module, which is the foundations of health and disease. It kind of builds on your like current A-level knowledge because obviously everyone's coming into med school from so many different backgrounds. So it's kind of making sure everyone's up to speed. So it builds on like biology, it builds on your chemistry knowledge, and it adds a bit more knowledge. And then after you've done that, you then get into the more medicine specific. So it's not like a massive jump. It kind of gets you in quite slowly, which is quite nice.
Brilliant, thank you. So year 2, once again, you've got your clinical and community practice. This moves to a Thursday. And then you can see the other modules that you'll be doing. So neuroscience, the immune system, reproduction. So we block them together. And so what I should have said about these is like when you, especially in the first year, when you're learning about heart, lung and blood, what you're learning will be directly linked to what you'll be doing in the anatomy room as well to help reinforce that anatomy knowledge and that learning there as well. So you can see at the end of each year, we've got our integrated KT. So these are the knowledge tests. So that's the exams that the students have at the end of their academic year. And then you can see in year 2, we do an OSCE. So this is an objective structured clinical examination. And this is how we assess the more practical skills. So students, especially in the second year, it's those basic skills like, are they doing patient histories correctly? Are they able to use some of the basic equipment? Are they able to take bloods? So this is what we will be testing them on. So these are some of our facilities that we have here. So you can see on the left, this is our dissection room. If you go onto our website, you can actually do a 360-degree tour, so you can see a bit more about it, and it will be open on our actual open day as well. So that's where our students do their dissection. So the simulation suite is based over on the University of Brighton campus. So that is where, so you can see the students have got kind of a model there in the bed, and there's someone in a control room, and they can kind of change the symptoms of this model. So dependent on kind of what the student is saying into the headset, so what their diagnosis is, so they can kind of change it. There are some models that we can make bleed, so it looks like they're like, so how do people cope when there's lots of blood and those sorts of things. So we can really change the situations to try and kind of help students experience different conditions before kind of going out onto the wards. And then our clinical skill room, so these students are learning how to do injections into little fake arms. So just starting those basic needle safety, protection for yourself, and making sure you're doing it correctly for your patient as well. So year 3 is where it really starts to change. And so you will have, and this is where placements really start to kick in. And so you'll start to do blocks. So you can see we've got medicine, surgery, elderly medicine, and psychiatry blocked here. And so students will go on an 11-week placement block on those three areas, as well as having lectures on science, medicine, therapeutics, and also you can see the personal and professional development going through as well. So these are how the placements look in year 3. So under medicine, you can see the different subspecialities, and for surgery and for geriatric and psychiatry. So this is a really intense year. So it's a real change from what they've experienced from year 1 and year 2, because we're letting them loose on the wards a bit more. We're not with them quite so much, and they are really starting to see the different speciality areas within medicine. Hannah, how did you find that when you went into year 3? How was it for you?
It was quite a big transition, obviously going from lectures to being on placement 4 days a week, but the uni is really good at supporting with it. Obviously you're used to doing some sort of placement because you've done a little bit in year 1 and 2, which is quite nice to prepare you for this a little bit. And you also have these things called teaching fellows in year 3. So these are doctors that are basically there to help you on the ward sometimes. So they can help you find cases, talk to patients, teach you clinical skills as well. So that helps quite a lot with the transition in terms of that. But no, I really enjoyed year 3. Like the placements are really, really fun. And it's nice to finally be doing something more clinical as well. So you just get to practice everything you've learned on the wards too.
Yeah, thank you. So our placements, we do put our students all around the county. We don't have enough space to put them all into the hospital in Brighton, otherwise we'd have more students than patients in there. And we do have some regional placements. So if we have a look here, these are our main sites. So we've got Brighton, we go out to Worthing and Chichester, then we've got Eastbourne and Hastings. We also go up to Haywards Heath, and in year 5, we do have some students that go up to Red Hill, so just on the border of Surrey. So we do have some placements in Crawley as well, I believe. So there are various places that we'll be doing, and dependent on kind of the speciality will kind of depend on where the students are kind of being based as well, because our students quite often find that in the regional hospitals, they actually have a better experience because the doctors have and staff have a bit more time. The Royal Sussex is a trauma hospital. It's very busy. There's lots of cases going on. So it can be quite a busy place for doctors, and they sometimes don't necessarily have quite so much time for our students. So actually, Chichester, Hastings can be quite good experiences for them because there's just a little bit more time for them to be able to get the answers and from the doctors and like a bit more detail about what's going on. So in between year 3 and 4, we offer the students the opportunity to intercalate. So intercalation is basically where you kind of take a year out from your medical degree and you do another degree. So that can be an undergraduate degree, so a BSc, or it could be a postgraduate, so an MSc, so a master's. And that's for 1 year, and you will kind of decide what subject that area that is in. So there's a huge range of different areas that you can do this in. There's a website on there, so intercalate.co.uk is excellent. It has all the courses that are available that you can go and do. So you can do courses. We offer a range of courses at BSMS, so you can see them listed there: global health, public health, medical education. Our partner universities, Sussex and Brighton, both have some options as well. But a lot of students like to use this year to try out studying at another university. So in the past, we've had students go and study at Oxford, Plymouth, St Mary's, Manchester, Imperial. So a real range of different places, dependent on what it is, the course that it is that they want to do. So they will disappear for a year and then come back at the end of that year and then rejoin into year 4. Okay, this is optional. Students don't need to make this decision until year 3. There's no pressure when you first apply that you need to make that decision. Obviously, there can be financial implications about doing an additional year at university, so that would need to be taken into consideration for most students as well. So phase 4, I'm actually going to hand over to Hannah because Hannah is in year 4 now, so this makes more sense for her to talk about how this is going for her.
Okay, so yeah, I'm currently in my fourth year. I've nearly finished it now, but I think it's been my favorite year so far that we've actually done. So obviously you have 7 rotations in year four, and these are a lot more specialized. So you get to do, so I was really looking forward to doing pediatrics this year, which I really enjoyed and got to do that. And I think a nice thing about year four is you get a lot more involved on the wards because obviously you're a fourth year medical student now. You're a lot more trusting. You can like take notes on the ward rounds. You can help assist in procedures and everything, which I found really, really enjoyable. Um, and then we've also done our independent research project this year. So my project was on the effects of having a late diagnosis of autism and ADHD on a person's mental health. So we handed in our research projects last month and we're presenting them at the IRP like conference on Monday. And the IRP itself has been a really, really great thing to do. So in year three, they'll kind of send out a ballot and you can contact maybe like a doctor you know, or they'll send out a ballot with loads of different projects and you can like choose one that you're really interested in. So if you're wanting to go into, let's say, emergency medicine in the future, you can choose a project to do that is focused on emergency medicine, which will be great for your future. And hopefully people go on to like publish their projects, present them at conferences and everything. So it's a really great thing to do. And then again, like was mentioned, we do the Time for Autism project in fourth year as well. So I've just finished my last visit last week and it's been an amazing experience. Obviously, everyone with autism presents differently and I think it's great to be able to speak to someone, see how they're coping, how they're adapting, and everything like that. And we write like a little health passport for them and everything, and we get to share it, and we do a little conference as well. So yeah, year four has been a great experience for me. It's very fun and yeah, the rotations are great as well.
Thank you. So, and then we come on to the fifth and final year of the degree. So, this year five is actually a really short year. Although they're here with us until June, their actual teaching is quite a short period. So, finals for students, medical students, take place in February. So, it's very early. And so, they will know from about March time whether they passed and have qualified as a doctor. So in from September to December, they will be going back around the rotation. They'll be on placements, but they're kind of covering the placements that they did in year three. So they're having a recap of what the placements they had in year three. So they will be going around medicine, surgery, psychiatry, those areas again. Now that they've got more knowledge and be able to put more detail into it. So then in February, they have their MLA, so medical licensing assessment. So this is a national exam. So it's the same exam that every student at every medical school sits. And that, so this is why every medical school has the same curriculum. We just teach it in different orders and in slightly different ways. But this is a national exam that all of our students sit. So like I say, our fifth years know now whether they passed their fifth year and are qualified as doctors, and they're actually on foundation year zero. So this is where students are in the hospitals, they're kind of working as doctors, obviously still being overseen, but they're starting to get a lot more freedom. So this really helps with them with their integration for when they actually start as a doctor in their first job in August, because they kind of understand how the wards and how the processes work, and it makes that transition a lot easier. So after the foundation zero, they have an elective. So this is a 6-week period where they can choose to go and work in any kind of medicine that they want. So some students will use this opportunity to go overseas and try working in a different kind of healthcare setting. So in the past, we've had students go to New Zealand, Australia, America, France. This year, I'm aware that there's a group of students going over to the Philippines to work in the medical system over there. So it's a way for students to be able to learn medicine in a different environment, learn different skills, and just kind of have a bit of a different experience from the rest of their medical school. They don't have to go overseas. A lot of our students will actually stay or might go back to and do a placement near where their family lives if they're thinking about maybe going up there to work at a later date as well. So there's a real range of things that people will do in their elective. And then our graduation takes place in July normally. So that's kind of how year five, that's our curriculum and how it kind of set over the different 5 years. So once students have graduated, they will go into the NHS workforce, and they will start their new job like I think it's the first week of August. They all start on a Wednesday or something like that. So, and then they are a foundation year one doctor. So what happens is that when they're applying for jobs around, they will do three kind of different specialisms in their year foundation year one, and in foundation year two, they'll do three different specialisms. And that's what they'll be working on those 3 years. So they will still be having lectures, they still have to go to talks, there's still there's still exams that they will need to do. So that is kind of built into their foundation year one and foundation year two. During foundation year two, they need to start thinking about what type of speciality it is that they want to go into. So whether that is surgery, whether that's pediatrics, anesthetics, GP training. So then they need to make that decision, and they will apply for that specialist route-way training. So you can see on this picture that there's kind of two different ways. So GP training is slightly different to the rest of the speciality training. It's slightly shorter. It's 3 years. And so you'll be kind of training as a GP in a GP practice for 3 years before you're kind of fully qualified as a GP. So other specialities tends to take longer. It will depend on the speciality that you are going to be going into. Will depend on the length of training. So you can see you kind of going through, and so all through this time, our doctors are being assessed. They're doing exams to kind of get to the next phase of their training. So that's how they kind of go up through the ranks once they are graduating and working as a doctor. So on to our admissions. So that's kind of given an overview of the course and a bit about BSMS. So what about our admissions process? So our admissions process has actually changed for this year. So we ask for 3 A's in your A level, and it's biology or chemistry, plus one other subject from biology, chemistry, maths, or physics. Okay, so that's what we are looking for. So our standard offers, we will be looking at your GCSEs. We only look at your maths and English. We don't look at any other GCSEs. We are only looking at maths and English. And that could be English literature or language. We don't mind which one it is. So our adjusted offer, we will drop a grade to 2 A's and a B, and grade 5 for the maths and English. So I'll come on and explain what the adjusted offer is in the next couple of slides. So we ask our students to sit the UCAT, and I think registration for the UCAT has just opened or is just about to open for this year's kind of cycle. Testing takes place in July, so the summer holidays. There's no advantage whether you do it at the beginning of the summer or the end of the summer. It's just when you feel that you're best placed to take it. So we haven't released what our cutoff is for this year. We will be looking to do that in about 2 weeks' time. Once we've made all our offers, we will be updating our website, and we will have our UCAT cutoff scores on there, so you'll be able to see what it was for this year. But we will not accept any candidates that achieve a band 4 in the SJT. So that is one of our cutoff points. So the way that we interview at BSMS is that we use multiple mini interviews. So we do 5 10-minute interviews. So each interview has like a different theme. So the questions will all be around that theme. Like I mentioned earlier, students have the opportunity to choose to interview with us either in person or online. They're exactly the same questions for both formats, so it doesn't have any advantage. It's more of a preference, and it could be down to logistics. We're very aware that if you are based up in Manchester, it takes a long time to get to us and can be quite expensive. So this is why we offer the students the option of in person or online. So once we finished our interviews at the end of February, and so we'll start making offers. We actually start making some of our offers in December. So to high achieving interviewees, we'll start getting offers from December. And we've got up until, like I said, the 13th of May to make all of our final offers to go out. I don't think we'll be making many more, if any. So that's the process, and then students have that time to decide who they want to put as their firm university, and who they want to put as their insurance, and then they'll reject any other offers that they have. And then hopefully, if you decide to choose us as your university, you do really well in your exams and get your grades, you'll be starting with us in that September. So it's normally about the middle of September, the second week of September is when students normally move in to campus. So what is our adjusted offer? So to try and widen access to medicine, we do an adjusted academic offer. There's various criteria that students need to meet, and I'll show that on the next slide. But if you meet these criteria, we will reduce your GCSEs down to a grade 5. We'll drop a grade for your A levels, so that will be 2 A's and a B. And then if you're doing the IB, it's 35 points. So that is what our offer is looking for. So these are our criteria. So there's a range of different things, and some of it I'm aware there's lots of strange names like polar, tundra, those sorts of things. So the geographical section is basically looking at your postcode data. So if you go onto our website and there's a QR code which you can scan and it will take you through to relevant bit. We've got links where you can put your postcode into these like checkers, and you can see if you meet these criteria. Education, that's once again, you can look up your school if your school's performing well or not. We've got links to that on our website as well. UCAP bursary, we will be sending that information. That's an easy one to check. It's free school meals, and then you can see all of the other bits and pieces. So applicants need to meet one criterion from at least 3 different sections. So there's 4 different sections. You need to meet one from at least 3 different sections to be eligible for the adjusted offer. Sorry. If you are a care leaver, there's a section on our website. So once again, definitely go and have a look at that. But we would give you a guaranteed interview as long as you're meeting our academic criteria. So accommodation. So I'm aware that accommodation quite often plays a big part and worries people a lot. So the way that our accommodation is, because we are joint between the University of Brighton and the University of Sussex, we do have accommodations with both of our partner institutions. Most of our accommodation is on the University of Sussex campus. So we've got Lewis Court, Brighthelm, Northfield are all on the University of Sussex. And then Varley Park is on the University of Brighton campus. So you can see the costs for each of the rooms. So basically, if you have an ensuite room, it will be more expensive than if you use shared facilities. And that kind of reflects in the prices that you can see on there. These prices do include all your bills, so water, electricity, Wi-Fi. There's some contents insurance included as well, and cleaners will come and clean the communal areas of these flats as well. You've also got, by being on campus, got the added bonus of campus security. So if there's problems, they're there to help support you, not just when you get locked out of your bedroom, which is quite regular in the first few weeks. So Hannah, do you want to talk about what your experience of living in halls was like?
Yes, so I lived on a halls that they don't actually use anymore, but I was in an ensuite, and I think there was about 8 of us in our accommodation. And what's quite nice about BSMS is they put all medics together. So my whole flat was just other first year medical students, which I found was really, really good, especially when you kind of go in and you're really nervous on your first day and you want to go to like medic fresher events together. You can all go as a house, all go together, which makes it so much easier. And you've got people in your course you kind of already know that you can go to lectures and everything with. It's also great because like you have exams all at the same time, so you're all kind of in the same boat and everything. But I think, yeah, living on campus was a great thing. Obviously, it's easy to walk to lectures. You're so close to like central town and everything. So accommodation was really good. But again, I know people who commuted again and they still had like an amazing experience as well. So whichever one, yeah.
Cool. So this is just a little bit of a map of where the accommodation is. So on the University of Sussex campus, you can see, if you look at the bottom of the map, you've got the BSMS teaching building. So that's where your lectures will be in the first year. And the accommodation is literally at the furthest end of the campus from where we are, but we couldn't get much further away from it. And it takes about 15 minutes just to walk up to the teaching building. To get over to the Watson building, which is on the University of Brighton campus, it takes an extra 10 minutes. So it's about a 25-minute walk from those purple halls of residence that you can see there, which we use. So Varley Park is a little bit further out. So this is the University of Brighton. This map is a bit deceptive. It does look like it's absolutely miles away, but it's not that far. It's about a 34-minute walk to the campus. There are buses that loop past that accommodation and come up onto the Sussex campus, so you can do that as well. Brighton is a very well connected city with buses, trains. We've got like the equivalent of we've got bikes that you can hire as well. So and they're located on all the campuses as well, so you can hire them and take them into town. So you can get around Brighton and the campuses very easily. So student life. So MedSoc is our kind of overarching kind of organisation that oversees all the societies and sports. So as a medical student, you'll become part of MedSoc. So this is run by medical students for medical students. So they organise our freshers' fairs, they help with creating the medic families, so finding volunteers in the second and third years to help buddy up with the first years. They organise balls, sports events. So we do a sporting competition. I think it's against the University of Southampton. So our medics sports teams will compete against the University of Southampton's medic sports teams. And so like a varsity event, so, provide some survival guides as well. So Hannah, how have you found student life at university?
So yeah, it's been great. Obviously there's a lot of BSMS specific societies and you can see some of them on the screen here. I've been involved in a couple of these. So I've been on the committee for Med Art, which has been great. We do lots of art events for people. I've been on the Pediatric Society, the Anatomy Society. Like there's so much to offer and you can make a society up as well. If it's something that you don't like, you can make one to kind of join it. And then again, in terms of sports society, so I think in second year I was on the BSMS like Women Football Society, and we played varsity against Kent as well, which was quite fun as well. But I think another great thing is obviously because you're a part of Brighton and Sussex unis as well, you can join societies on both of those campuses. So in first year, I think I did badminton with Brighton University, which was really nice. But no, the societies have been great. They hold like revision events for you close to your exams and everything. Like people from the older year run things. And yeah, it's a really great community. And yeah, student life is great at Brighton, obviously being in a student town as well. So it's really nice.
Oh. So we've got some of the societies and then some of the sports. So I always think we have people in Brighton that swim in the sea all year round, which I do think they're slightly bonkers. But yeah, so there's that option too. So there's some of the sports and societies that we have. So that has come to the end of our talk. Enjoy your evenings. Lovely to kind of virtually meet you. And hopefully you found that beneficial and answered a lot of your questions. So thank